tragic as it is, it was due to natural causes, we believe, and also whatever health issues he was struggling with, I'm told by the doctor, were not infectious. So the ship is safe when it comes to that.
As a deadly hantavirus outbreak on a cruise ship draws intense scrutiny, an old video of the ship's captain has suddenly gone viral across social media and news platforms. The ship's captain can be heard reassuring passengers that the first death on board was not caused by an infectious disease, giving a false sense of safety before the true cause became clear. The footage was recorded on April 12th, several days before health authorities officially confirmed a hantavirus outbreak linked to the vessel. The first passenger on the ship began feeling ill on April 6th and tragically passed away on April 11th, becoming the initial confirmed case of the outbreak. The highly contagious and deadly hantavirus has already claimed at least 3 lives among those who were on board the cruise ship. So far, a total of 8 confirmed or suspected cases of hantavirus have been traced back to the cruise ship MV Hondius, raising alarm among health officials and passengers. Meanwhile, the World Health Organization has stated that the overall public health risk remains low at this stage, even as investigations continue. The WHO also warned that the hantavirus incubation period can last up to 6 weeks, which means more cases could still emerge from people who were on the same ship. The MV Hondius is now scheduled to arrive at the Canary Islands on May 10th, where health authorities are expected to conduct strict screenings and quarantine measures upon its arrival.
This is my sad duty to inform you that one of our passengers sadly passed away last night. Tragic as it is, it was due to natural causes, we believe, and also whatever health issues he was struggling with, I'm told by the doctor, were not infectious. So the ship is safe when it comes to that. Of course, it's a very, very sad circumstance that will have an effect on our operations. I'll leave the details to Hans. Look, it happens at sea sometimes, very sad, very tragic. Do everything we can in order to make sure that all the duties are observed and done in a dignified way. We're in the middle of the Atlantic. It's only a few places we can go to. These places happen to be on our itinerary. This is secondary though. Anyways, the ship is safe. This gentleman unfortunately succumbed to natural causes. And like I say, we'll do what we can in order to continue in a safe and so dignified way.
Last Saturday, the United Kingdom notified WHO under the international health regulations of a cluster of passengers with severe respiratory illness on a Dutch-flagged cruise ship, the MV Hondius, which had traveled from Argentina to Capo Verde. So far, 8 cases have been reported, including 3 deaths. 5 of the 8 cases have been confirmed as hantavirus, and the other 3 are suspected. Hantaviruses are a group of viruses carried by rodents that can cause severe disease in humans. People are usually infected through contact with infected rodents or their urine, droppings, or saliva. The species of hantavirus involved in this case is the Andes virus, which is found in Latin America and is the only species known to be capable of limited transmission between humans. In previous outbreaks of Andes virus, transmission between people has been associated with close and prolonged contact, particularly among household members, intimate partners, and people providing medical care. That appears to be the case in the current situation. The first case was in a man who developed symptoms on the 6th of April and died on the ship on the 11th of April. No samples were taken, and because his symptoms were similar to those of other respiratory diseases, Hantavirus was not suspected. The man's wife went ashore when the ship docked at the island of St. Helena and was also symptomatic. She deteriorated during a flight to Johannesburg on the 25th of April and died the next day. Samples were taken which were tested at South Africa's National Institute of Communicable Diseases and confirmed as hantavirus. The third death was of a woman on the ship who developed symptoms on the 28th of April and died on the 2nd of May.
This is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those out there who are asking these types of questions. But this is not the same situation we were in 6 years ago. It doesn't spread the same way like coronaviruses do. It's very different. It's that close, intimate contact that we've seen. And most hantaviruses don't transmit between people at all. Most hantaviruses are transmitted from rodents or their feces or their saliva in their droppings to people. And only this one particular virus, the Andes virus, which has been identified here, we've seen some human-to-human transmission. And again, I want to reiterate, the actions that are being taken on board are precautionary to prevent any onward spread. And so there's a lot that is being done right now to be able to try to minimize the risk even further.